Greetings to my colleagues and good afternoon. Today, I'll be talking a subject which is close to me, particularly as a community medicine specialist, that is lifestyle modification, hypertension control, and particularly for all ethnic, or particularly for Asians and Indians, why it is more important perhaps than the Caucasians. So I'll just first give an overview of the burden of hypertension in different continents, what are the major causes, and what we mean by lifestyle modification and why it is important. So first, the definition is ideal definition is that any blood pressure which is higher than 140 or 90 is labeled as hypertension. Of course, there are individual variations. These are statistical normality. Nowadays, they with age, there are natural physiological changes with age. There, particularly after 65, the systolic blood pressure rises. But any blood pressure above 100 requires evaluation and management. First by lifestyle and then by clinical management, by drugs if required. And what is the global burden of hypertension? It accounts for millions of deaths a year, nearly one third of the total. Complications of hypertension per se is not a disease. It is having a high blood pressure leads to number of target organ involvement, like it affects the vision, the retina, it affects the heart, it affects the kidney, and through these secondary effects on target organs, it can shorten the lifespan. It is something like your car, you have a tire pressure. Immediately the tire pressure, either very low or very high, will not harm the car, but in the long run, it will cause problems. Hypertension is responsible for at least 45% deaths due to heart disease. So it's a major risk factor for coronary artery disease and different cardiomegaly and left heart failure, congestive cardiac failure if untreated. So these are the region-wise age standardized prevalence of raised blood pressure in different age groups in adults above 25 years, WHO region. The extreme left is the African region, America, region of the America, Eastern Mediterranean, then European, then Southeast Asia region, and the Western Pacific region. The highest you will see is the African region. And then on the right side is the association of hypertension with the affluence, income. Africa, ethnically, the African people of African origin have a higher blood pressure, and even in this recent pandemic also in the USA and other European countries, they suffered maximum from COVID mortality because of untreated high blood pressure. There were some papers where they found, because most of them, when they migrate to Europe and the West from the African region, they are slightly marginalized and they already have a predisposition to high blood pressure, and they were more vulnerable to the ill effects of COVID, which affected people with comorbidities. So hypertension was one of the comorbidity which drove the COVID-19 mortality. So we have to keep this in mind now after the experience of the present pandemic. Hypertension, having an ideal blood pressure, not only protects against non-communicable disease like coronary artery disease, stroke, other renal failure, protects against, but it also protects us from becoming vulnerable to other infections like viral infections or respiratory infections like we had the COVID-19. Then if you see, the income is also very interesting, that the blue color is this lower income and the lower income, lower middle class and upper middle class and high income. If you see, there is not much difference, and the lower income people are nowadays as much susceptible to high blood pressure as the higher income. Because if you remember, when the pandemic of non-communicable disease started globally, the global trends of non-communicable disease increased. It started with the affluent classes, and when we were in college, it was the affluent people who were more vulnerable to hypertension, diabetes, coronary artery disease. But now with the growing economies, it is the lower income, blue collar workers, middle class workers, who are also being susceptible to high blood pressure and disease of affluence because of fast food and easy economy, fast growing economies. Like Brazil is a good example. It is also having a very high obesity rate, almost as much as the West. The Brazil economy and our Indian economy is also developing very fast. So we have to be careful at this stage to control or firstly the obesity, rising obesity, the sedentary lifestyle, and of course, or blood pressure. So this is as we saw, highest is in the African region, hypertension prevalence by WHO region, pictorial presentation. Africa has the highest, 27%, then Southeast Asia is 25%, and higher than Europe, on Americas also. If you see the African and Asian continents, so specialist as Indians, the Southeast, we are the second highest hypertension prevalence in the world after the African region and Eastern Mediterranean region, which is 26%. There are many factors. The genetic factors are also have a role, as we will see, why the Asians and Africans are more prone to high blood pressure. National burden, coming to the Indian scenario, the overall prevalence for hypertension in India is around almost touching 30%. And between rural and urban parts, rural parts is 27% and urban is 33%. It is a matter of concern because if you see, we are a younger population. 80-90% of our people are below 60 years. We are a younger population compared to Western countries. Western countries are older population. So having a prevalence of blood pressure almost 27 to 30%, younger population is more serious burden than in a country like the Europe and the Americas, where they have got an older population, where it's a physiological reason for having a high blood pressure in the population. So here we should have a lower blood pressure, and paradoxically, we are having a higher blood pressure in the Africa and the Asian countries. Regional estimates of hypertension: 14.5%, 31% rural, north, east, west, south. So overall, it ranged from 14% from rural, northeast. Northeast, we are the lowest because they are tribal people, they are hill area, they must be doing a lot of exercise, climbing up and down. That may be one reason. And the plains, they are having higher blood pressure. In the mountains, blood pressure is a little low, but in the plains, we are. And the majority of people who have blood pressure, particularly where we don't have proper health services, it is incident. They are not aware that they have blood pressure. You must have heard of rule of half, that 50% of people with high blood pressure are not aware that they have high blood pressure, because in the early stages there are no symptoms. It is asymptomatic. Only when the target organs are involved, person, or sometimes by incidental reading when visit to a hospital or a medical center, a blood pressure, or by screening programs, blood pressure is incidentally detected, high blood pressure. So majority are unaware of their high blood pressure. So that is another hidden burden, the iceberg phenomena. And only 25% of rural and 38% of urban Indians are being treated for hypertension. Because awareness, compliance can be poor because there is no discomfort. Just a person has blood pressure, he or she doesn't feel any discomfort. So firstly, they don't seek treatment. Firstly, they are not aware. Secondly, they don't seek treatment. Then they may drop out of treatment. And 1/10 of rural, 1/5 of urban hypertensive have them. So very few, only 1/10 and 1/5 of urban, 25%. Majority of people do not have proper blood pressure under control, in spite of perhaps treatment or lack of treatment. So things that increase the risk of having high blood pressure, some are modifiable, some are non-modifiable. Like age, age, gender are non-modifiable of genetics. Genetics are non-modifiable. Being overweight or obese, that is modifiable. Not being active, that sedentary lifestyle, that is modifiable. High salt diet is also modifiable. Drinking too much alcohol is modifiable. And actually, we should add smoking here. Smoking tobacco is also one of the major causes of high blood pressure. Tobacco use. Genetics, I would like to put in a special mention here about the Asian handicap. People, populations who have faced starvation in the past, famine in the past, they have got a genetic predisposition to the central obesity and insulin resistance and high blood pressure, non-communicable disease. Because their genes, due to natural selection, they develop the survival of the thrifty gene, that those people who have those genes which can store fat in the central part of the body, the trunk, they survive the famine and others perish. So this is one of the hypotheses why the Asians and the people who have faced starvation in the past. So similarly, there is a Barker hypothesis, that is the children intrauterine growth retardation and early childhood malnutrition, which is a problem in our country and African countries. That is the early childhood malnutrition when the mother diet is not there, intrauterine growth retardation. And in India, 20% of newborns may be low birth weight. And their child malnourishment up to under 5 child malnourishment is almost up to 35%. So these can also be part of the lifestyle of mother, pregnancy, antenatal care, care of the child, proper nutrition in the early childhood. Because children who are deprived of good nutrition in early childhood or intrauterine period, according to Barker hypothesis, they are in middle age or when they become adult, they are more prone to insulin resistance and syndrome X, which is a central obesity, diabetes, hypertension. So this is the care in the child is also important. Factors responsible for modifier factors, as we said, is the sedentary lifestyle, smoking and alcohol and diet control and sad and ultra processed foods. That is a modern menace. And non-modifiable risk factors are the genetics and your age. And of course, there is not much gender difference in hypertension. So even if you have got a non-modifier, even if there are studies which have found that even if you are genetically predisposed to high blood pressure and you are an elderly person which you cannot control your age, but if your lifestyle is good, they can counteract, they can balance the risk and still you can lead a healthy life free from hypertension, or you can control our hypertension. You can reduce the need for medications or dose of medication by modifiable risk factors. So even if you have got non-modifiable risk factors like genetics and age, but with control of your modifiable risk factor, that is lifestyle, you can negate the negative impact of non-modifiable risk factors. So this is important. So obesity is a very important cause of risk factor for hypertension. Excess weight gain with associated increased visceral adiposity is a major cause of hypertension, accounting for 65% of the risk for primary hypertension. And similarly, if it is a risk for primary hypertension, if a person can control the weight or reduce the weight, the requirement of antihypertensives decreases, and sometimes altogether he can bring down his blood pressure appreciably. The mediators of abnormal kidney function may increase blood pressure during development of obesity. Hypertension include physical compression of the kidneys by fat and in and around the kidneys. That is central obesity. Indians are prone. Activation of renin, angiotensin, aldosterone system. Increased sympathetic nervous system activity. These are all linked with insulin resistance also. If you notice this, in insulin resistance also there is increased sympathetic nervous system activity. Renin, angiotensin, aldosterone system is interfering in insulin resistance. So in our Indian context, we have a interface of insulin resistance and high diabetes burden, and which also predisposes to high hypertension burden. Salt intake, excessive dietary salt intake, major risk factors for stroke and other. So this causes increase in blood pressure and most common source. You may be taking the salt as advocated 5 gram or 10 gram per day, but the invisible salt in the fast food and ultra processed food is a major source of salt and unhealthy diet nowadays with increasing affluence and high scale marketing. Alcohol intake, meta-analysis found that chronic consumption of alcoholic beverages, high incidence hypertension, the moderate alcohol, the women are more susceptible to ill effects of alcohol and hypertension than men. And of course, tobacco intake. Tobacco intake is also a major risk factor for high blood pressure. Particularly people below 50 years, insulin resistance, as I have been stressing, may contribute to hypertension because of impaired vasodilatation, endothelial dysfunction, effect on sympathetic nervous system, sodium retention by kidneys, and effect on renin, angiotensin, aldosterone pathway. So these are the basic biological pathways of hypertension and which can be modified by lifestyle. So I just wanted to give you the basic science behind the lifestyle because the insulin resistance, the best way to cope with your insulin resistance is the lifestyle modification. WHO introduced the SAFER initiative. So that is a that is an acronym for SAFER. Is S is strengthen restriction on alcohol availability, advance and enforce drink driving countermeasures, facilitate access to screening, brief intervention and treatment because hypertension is mostly asymptomatic, enforce bans or component restriction on alcohol advertisement, raise prices of alcohol. So this is basically to deal with the alcohol intake. Physical activity, regular physical activity associated with lower blood pressure, reduce cardiovascular risk and cardiac remodeling, as well as it can reduce insulin resistance. It improves the insulin sensitivity. So insulin resistance is physical activity is very important in insulin resistance. Important of doing aerobic activity is it reduces blood pressure, it reduces body fat, serum triglycerides, serum cholesterol, and insulin sensitivity. So as I said, most important step in coping with insulin resistance, which is also associated, is physical activity, aerobic activity, physical activity. Dietary modification, lifestyle also includes dietary modification, traditional lifestyle modify, reduce blood pressure, sodium reduction, weight loss, moderation of alcohol intake, and increased physical activity. Dietary modification, most important is to avoid the fast food and processed foods because these processed foods have got very high salt content. And the fast food also has got very high sugar content and refined carbohydrates. These also leads to insulin resistance as well as obesity and hypertension. The policy making body now recommends a healthy dietary pattern, one that is rich in fruits, vegetables, low fat, dairy products, and reduce in saturated fat, total fat, and cholesterol. Of course, nowadays, the consensus is that the sugar and carbohydrate, refined carbohydrates, are more harmful than saturated fats. Saturated fat and cholesterol are not as important and not thought as important today. In fact, they reduce reduce your cravings for sugar. In fact, the stress on saturated fat increase obesity in the Western countries, and the sugar consumption increase. So saturated fat is not the major culprit today, but the sugar is and refined carbohydrate is. So in your lifestyle modification, as far as diet is concerned, you should pay more attention on reducing sugars and refined tea. A little saturated fat will not cause you much harm. But fruits, vegetables, about 5 helpings of fruits and vegetables are recommended. One helping is about 70 grams. So fruits, vegetables, it has potassium, fruits and other things which has a good impact on lowering the blood pressure. and antioxidants. So for overall health and also for controlling blood pressure, high fruit intake is important. In environmental stress, we are having, these are for public health measures like air pollution also contribute largely in the epidemiology of hypertension. Urban areas, air pollution, traffic pollution, improved air quality, these are all public health measures. And risk communication, policymakers, you have to lobby, citizen groups, civic society has to lobby, and cycling tracks and other exercises, pedestrian tracks will reduce the use of automobiles. Many times we use the automobiles because we pedestrian pathways are not there, cycling tracks are not there. So if we have more of that, we will also contribute to physical activity of the people as well as reduce the air pollution. So if you have better friendly, pedestrian friendly and bicycle friendly environment, it will increase the physical activity as well as reduce the air pollution. This should be encouraged. Reduction of mental stress. These are lifestyle, modern lifestyle is becoming very stressful. Chronic psychological stress. It starts from school age, coaching classes, competition, then later job competition, economic setbacks, recessions, like a lot of people are laid off jobs. So all these are cause of stress, which in turn can cause high blood pressure. So we should have exercise is one way, games, recreation also one way to reduce the stress. It releases the endorphins, which has a almost like nature's opioids without resorting to drugs or sleeping pills. If you exercise, you increase your physical activity and you reduce your stress level also. You play games. Non-modifiable risk factors are genetics, and here the Asians are more vulnerable. So anyway, as I said, even if you have got genetics, with your lifestyle, you can counter the ill effects of genetics and non-modifiable risk factors. Same holds good for age also. Physical activity in old age is also very beneficial, not only for control of hypertension, but also to make your bones stronger and to make your muscles stronger. It can reduce it. Also, exercise and good diet also improves the cognitive functions in old age. So exercise has got benefit throughout your life's course, from childhood to middle age to elderly. Exercise, physical activity is very desirable for number of conditions which are becoming a burden. More common in males, female experience a much sharper inclined blood pressure from the decade. Mechanism of these, the hormonal changes. Females have got certain stages in life, menopause or menarche, pregnancy-induced hypertension, psychosocial, gender, socioeconomic deprivation. So by and large, there is not much difference. Females are as vulnerable as males and males are as vulnerable as females, but there are certain hormonal changes, certain stages in life which are. Prevention of hypertension is not only at the individual level, because if you are changing lifestyle of a person with high blood pressure, you are making a very small impact. So what is the approach as community approach is the population level approach, that there is no sharp that you only catch the high risk people, because majority of people with high blood pressure may be coming from non-risk factors from the general population. It's a continuum. There is no sharp cutoff beyond this. The risk is less. It's a continuum. So the primary prevention depends on the population strategy rather than the high risk strategy. High risk strategy or secondary prevention is only those who have detected with high blood pressure. You are advocating the measures to them of exercise and all that. So only very few people you will catch. 70% people may miss, because today a person who is normotensive will become hypertensive tomorrow if the person does not continue a healthy lifestyle. So population strategy is that even all people with or without hypertension, with or without risk factors, all will be encouraged to follow a good diet and a healthy lifestyle and exercise and avoid sedentary lifestyle. So that is the population approach, and that yields better results than only high risk strategy. So this was the epidemiologist Geoffrey Rose. He was a famous cardiologist and he did a lot of work in cardiovascular epidemiology. He gave the concept of prevention paradox. That is, to a large number of people have to take a measure to benefit one person. If you want to prevent one hypertensive going into complications, you have to address the whole population. And it helps overall, the whole population curve has to shift towards the healthy side because it's a continuum. Whether it's blood pressure, whether it is ये, you cannot say कि 140 के ऊपर ही है तो 139 वाले को भी थोड़ा रिस्क है, 140 वाले को नहीं, 138 वाले. So जितना जितना कर्व हेल्दी साइड में शिफ्ट होगा, the overall impact on population health would be beneficial than only holding the tail of the curve, which is a very small portion, and treating them. That is the high risk strategy. And population strategy is treating the whole curve. So this is and this has to start from a young age because the habits they track, unhealthy habits, eating habits in children, they track to adults. Unhealthy lifestyle in children track to adulthood. So from a young age, you have to make playgrounds in schools, parks, middle age in occupations. Now, most of the occupations nowadays, like software and other occupations, are sedentary. So you have to think of ways to have some sports activities in an occupational setting. You can have some breaks to have some skipping or some music or something where you can do exercise in the office, because most of the jobs are sedentary, and some of the software people, they put some timers. After 1 hour they will have a music and they will get up and move around, walk around for 5 minutes and again come back. So these are some of the methods one can think of, innovations in the office. Otherwise it is sedentary from morning to evening. So primary prevention is population strategy, as I said, directed at the whole population irrespective of individual risk levels. It includes dietary changes, reduction in salt intake, moderate fat intake, avoidance of high alcohol intake. Tobacco is there. I don't know how we have missed it here in the slide. Tobacco control is also a major. Weight reduction, exercise promotion, behavioral changes, health education, and self-care. All these I have covered from schools to workplaces. And a culture of physical activity and healthy lifestyle. And another thing nowadays is from children are becoming the targets of advertisements of the food industry, from ultra processed foods to high salt to sugary drinks. So the health education can be started from school level, how to promote healthy eating and how to identify this propaganda of the marketing of fast foods and unhealthy. High risk strategy is only people whom we have detected to having the risk factors or who are having high blood pressure. So that is actually clinical medicine, high risk strategy. Population strategy is community medicine, how you address the whole population and educate them, empower them. And high risk strategy, people with high risk, with family history, tracking blood pressure from childhood may be helpful. As I said, even not only the lifestyle and habits, some traits like high blood pressure in child may continue as high blood pressure in the adults. Secondary prevention is the control and treatment, early case detection, pharmacological treatment, and patient compliance. Patient compliance is a challenge, so good education has to be required. And these are some of the references. So I have tried to stress on the lifestyle. I have not, I'm sure we will having a separate session for pharmacological treatment by clinician. So this is the lifestyle, which is the basic role of the community medicine or population strategy. So I think I have finished. So any questions? I can take a couple of questions.
Thank you, sir, for that wonderful presentation. We have few questions from the audience. Let's go on to the first question. So my first question to you is, what type and amount of physical activity do you find most effective in managing hypertension? Are there any particular exercises or routines that you advise for patients with varying degree of hypertension?
The best exercise, the minimum exercise is at least 30 minutes of brisk walking, preferably 5 days in a week, or preferably daily. And either it is brisk walking, and first get the fitness from your personal physician. You should not overexert yourself if you have got some heart condition or other condition. If you are fit, then 30 minutes of brisk walking, cycling, or swimming, or any sports which you are interested in, tennis or badminton, according to your physical fitness. And this is can be all ages. In fact, children should play more. They can play more. The 30 minutes is the minimum. And of course, you should not overstress also, that each person will have his or her own that would be gradual, with gradual training. If you want to exercise more, you have to have a under supervision of an expert coach or a physician. Overstress is also, extremes are, both extremes are bad, but minimum is 30 minutes a day of brisk walking, so that you get a light sweat on that.
Thank you for that answer, Moving on to
And
the
I have just read an article recently कि if something is better than nothing, even 5 minutes of brisk exercise, it opens up your circulation, it opens up your lungs, it opens up your circulation, and it shows. So even 5 minutes is beneficial. So 30 minutes is ideal. Even 5-10 minutes is. So as I said, you just get up. If you have a sedentary lifestyle, every 1 hour you can get up and walk for 5 minutes, 10 minutes. So that also is a very. It adds up to the benefit, cumulative.
Thank you so much for that answer. Moving on to the next question. My next question to you is stress is a known contributor to hypertension. Can you discuss some effective stress management techniques that patient can easily incorporate into their daily lives?
Stress management, there are many ways depending on the personal likes and dislikes. Some people are fond of music. So listening to music is also a good stress reliever. And exercise itself, playing a game or running or walking briskly, you will find there are certain endorphins which are released, which release, it acts like a natural opioid. You don't have to get addicted to it. In fact, one gets addicted to exercise. If you do exercise daily, one day if you miss exercise, you feel a bit discomfort. So exercise itself is a stress buster, and it also increases your physical activity. Some people go for meditation, and some people, those who are religious, they visit the religious places. So each one, some people would read a book to relieve a stress. So it's one has to find one own to find peace. So that is definitely one should find where we can relieve the stress.
Thank you for that answer. My third question to you is one of the challenges we face is ensuring patient adherence to lifestyle modifications. What strategies have you found successful in motivating and sustaining long term lifestyle changes in patients with hypertension?
The earlier you educate right from school children, we take sessions for school children, we take sessions for college students. When we go for, our team goes for the periodic medical examination, that is the time we take a session on physical activity and diet. And in the community also, we arrange education, particularly to women, because they are controlling the household food items, and so these are educating, and in simple language explaining to them something like they can understand. Like I said, high blood pressure is asymptomatic, so they will not seek treatment on their own. So you have to tell them it is like when you go, you check your tire pressure. Tire pressure, car is running, but still you want the ideal pressure, because it will cause wear and tear of the tire. So if your blood pressure is not ideal, it will cause wear and tear in your body after years. So you have to convey to them. So once they understand, they will definitely, they are motivated to comply.
Thank you for that answer. Moving on to the last question for the day. So, given your extensive background in community medicine, could you discuss any community based interventions or programs that have been particularly successful in reducing hypertension at a population level?
There have been a number of studies. There have been studies like modifier risk factor intervention studies, which is known as MR-FIT studies. Then there have been studies where they gave education to the community and before and then checked afterward. So at small scale studies, experimental basis, they have been successful. But this is a challenge because nowadays people are very their job and their movement they have become very mobile. So the community life itself, because once you want to practice community medicine, you should have a community. But nowadays the communities are disintegrating. So you don't know your neighbors also. So that is a big challenge. So I think nowadays one has to use the social media. I think like this type of videos and messages. So because community has to stay to. So that is one challenge now. But earlier, traditionally, they have done a lot of studies like modifiable risk factors intervention study. That is called MR-FIT studies. Another study which they had done in Finland, where they gave intensive health education on smoking cessation, and then so they were effective at a community level, where a group of people act as peer pressure to others. So now the communities are disintegrating. So now we have to go to other channels.
Thank you for that answer. If you can sum up this session in 1 minute, I mean, your final takeaways for the day.
Final takeaway is that this lifestyle, we are having the major challenges of the market forces. Actually, whether it is alcohol, a lot of the alcohol consumption has increased. Like we see in our colleges now, even the ladies are taking to alcohol. So that is a challenge because we are up against heavy odds of high market forces. Then there are other challenges. Pharma industry is also promising, say, pills, weight reduction pills. So there, I think there is going to be $1 billion market for weight reduction pill. So people are moving towards passivity. So we are doing exercise, eating healthy foods. This becomes very unglamorous to majority of people. They say ki we can have the pill to reduce the weight. So we have to educate them that these have got the side effects we don't know. Better is to have a healthy lifestyle, simple lifestyle, healthy, but you will be happier rather than resorting to pharmacological solutions or quick solutions. So that is it is a easy. The important things are very simple. Unfortunately, simple things are very difficult to implement. You go for complex diet, you complex pharmacological products rather than simple diet. So important things to have good health are simple, but simple things are most difficult to implement.